So let's define some things here that I think it would be very good for you to know. These are the terms that we use in the hospital. And I think once you know these terms, you would be able to use it better. Once you see patients, you'll be able to diagnose these patients better. And again, this will help us kind of learn this course a little bit better as well. So when a patient comes in with chest pain, the first term that I want you to be familiar with is a STEMI, ST elevation MI. So ST elevation MI, these patients are not going to reach you as a hospitalist. I'll tell you why. So these patients have ST elevation on their EKG. Physiologically, what's happening here is that their coronary artery, one of their coronary arteries is completely blocked to the point that you have transmural infarction. So the whole thickness of a muscle is dead or is having ischemia. When that happens, you're going to have EKG changes, which is ST elevation on certain leads. And it's usually 2 leads on the EKG. So when you have that, these patients, when they come into the ER, they're not going to call you as a hospitalist. They're going to call the cardiologist, the interventional cardiologist, so that this patient can be taken to the heart cath. In fact, there is a rule, door to table, and a lot of hospitals compete in how much time it takes for the patient once they enter the door of the hospital to the time it takes the patient to go to the cath lab and has a heart catheterization. So these ST elevation MIs, these patients, again, they're going to go to the heart cath immediately. Now, in some cases, if you're working in rural areas where you don't have heart cath, TPA is your other treatment choice here. But the gold therapy, the gold standard is a heart catheterization. And in some cases or some hospitals that are rural, the patient gets transferred to another hospital where they have that ability to do that heart catheterization.